Your gums bleed every single morning. Your mouth is always dry. Your teeth are breaking down for no apparent reason. And everyone keeps telling you it's poor hygiene. But what if it's not? What if what's happening in your mouth has nothing to do with your toothbrush or floss, and everything to do with what's happening inside your hormones? Because there is a connection that conventional medicine completely ignores. And millions of women over 40 are suffering in silence, not knowing that the answer isn't at the dentist's office, it's in their hormones. For decades, oral health and hormonal health have been treated as two separate worlds. You go to the dentist for your teeth, you go to the gynecologist for your hormones. Nobody connects the two. But science tells a different story. Estrogen and progesterone, the two main female hormones, have receptors throughout your entire mouth, in the gums, in the jawbone, in the salivary glands, in the nerves. When these hormones drop during perimenopause and menopause, your mouth is one of the first places to feel it. And in this video, we are going to talk about the 5 symptoms that nobody is connecting for you. Symptom 1. Dry mouth. The first symptom is the most ignored of all. Not the dry mouth you get when you're thirsty. We're talking about a constant dryness. You wake up in the middle of the night and your mouth feels like sand. You need water just to speak comfortably. You carry a bottle everywhere and it still never feels like enough. Here is what is actually happening. Estrogen directly regulates saliva production in the salivary glands. When estrogen drops, and it does drop during perimenopause, those glands produce less saliva. And saliva is not just moisture. Saliva is a shield. It neutralizes the acid that destroys enamel. It fights the bacteria that cause cavities and infections. It protects the gum tissue. Without enough saliva, your mouth becomes vulnerable to everything. Cavities that never existed before. Infections that won't go away. Gums that inflame at the slightest irritation. All of it starting with a hormonal drop that nobody explained to you. Symptom 2. Bleeding and inflamed gums. The second symptom is the one that brings women to tears. The gums start bleeding. Not because anything changed in your hygiene routine. You brush the same way you always have. You floss. You do everything right. And still, every morning, blood. This is not your fault. Estrogen has a powerful anti-inflammatory function throughout the entire body, including in the mouth. When levels drop, the gum tissue loses that protection. It becomes hyperreactive. It inflames from stimulation that never bothered it before. It bleeds from a normal brushing. It hurts for no apparent reason. This has a name in the scientific literature. It's called menopausal gingivitis. It is documented. It is real. It is hormonal. And most dentists never make this connection during an appointment. Symptom 3. Burning mouth. The third symptom is the one that frightens women the most. A burning or stinging sensation inside the mouth, on the tongue, on the roof of the mouth, on the lips, on the gums. It appears out of nowhere, goes away for a while, comes back worse at the end of the day. It feels like you burned yourself on something hot, even though you haven't eaten anything. This sensation has a name, burning mouth syndrome, and studies show it affects women in perimenopause and menopause at significantly higher rates than any other growth. The reason? Estrogen receptors exist in the nerves of the mouth. When hormonal production drops and fluctuates, those nerves lose their regulation. They fire off pain and burning signals without any real injury present. It is neurological, it is hormonal, and it does not go away with toothpaste. Symptom 4. Bone loss in the jaw. The fourth symptom is the most silent and the most dangerous. Every woman who has gone through menopause has heard of osteoporosis. The drop in estrogen affects bone density in the hips, the spine, the wrists. What almost nobody mentions is that the exact same process happens in the jaw. The alveolar bone, which is the bone that holds each tooth in place, responds to the same hormones. When estrogen drops, it loses density, it thins, it weakens. And the consequences show up in ways that seem to have no explanation. Teeth that become sensitive without any cavity. Teeth that loosen without any apparent disease. Dental implants that fail, even when placed correctly. Research shows that postmenopausal women without hormonal support have significantly higher implant failure rates. Not because the procedure was done wrong, but because the bone that was supposed to hold the implant was being silently destroyed by an untreated hormonal drop. Symptom 5. Changes in taste and sensitivity. The fifth symptom is the one that makes women think they are overreacting. The sense of taste changes. Foods you loved suddenly taste metallic, or bitter, or just different from what they always were. Your own saliva can taste strange. Your teeth become sensitive to cold out of nowhere, no cavity, no crack, no explanation. Estrogen and progesterone directly influence the taste receptors on the tongue and the nerve sensitivity throughout the mouth. When these hormones fluctuate intensely, as they do during perimenopause, sensory perception changes along with them. You are not overreacting. You are not being anxious for no reason. Your mouth is responding to a real biological change. Knowing that these symptoms are hormonal changes everything, because now you can act with information. First, real hydration. Water throughout the day, not just when you feel thirsty. Reduce caffeine and alcohol. Both of them dry out the mucous membranes. Electrolytes help maintain cellular hydration. Second, xylitol. Products with xylitol, like xylitol gum, mouthwash, and oral spray, stimulate saliva production and protect enamel. They are simple, affordable, and they work. Third, bring these symptoms to your hormone consultation. If you are working with a menopause specialist, mention the dry mouth, the burning, the bleeding gums. These are clinical signals. They are part of your hormonal picture and they need to be part of the conversation. Fourth, find a dentist who understands integrative health. Ask specifically about oral health during menopause. If the only answer you get is floss more, you deserve a more informed professional. Fifth, do not accept "it's just aging" as an answer. These symptoms are not inevitable. They are not permanent. They are signals from your body asking for hormonal attention. And hormonal attention can change this picture. Your mouth is not betraying you. It is trying to warn you. Dry mouth, bleeding gums, burning, loosening teeth, changed taste. These are 5 different ways your body is saying that your hormones need attention. If this video connected even one dot that felt loose for you, share it with a woman you know who is over 40. She may be going through exactly this right now and thinking it is her fault. It is nobody's fault. It is biology. And biology can be understood. Subscribe to the channel, because there is so much more that nobody is telling you. And here is what is most frustrating about all of this. These women spend years going from appointment to appointment. They switch dentists. They switch toothpaste. They buy expensive mouthwash. They try everything they are told to try, and nothing works. Because nobody is treating the real cause. The mouth is a mirror of the body. What shows up there is not an accident. It is not bad luck. It is not carelessness. It is your hormonal system asking for help in a way you can see, feel, and taste every single day. And here is the good news. When hormones receive proper attention, the mouth responds. Women who begin adequate hormonal support report improvement in saliva production, reduction in gum inflammation, less sensitivity, less burning. The body wants to recover. It just needs the right conditions to do so. You are not old. You are not falling apart. You are going through a biological transition that nobody prepared you for. And there is a way through it.